Assalamualaikum and hi everyone. My name is Mirza Karmila Binti Zainol. I'm a 4th year student from School of Physics, majoring in Medical Physics from University Science Malaysia. Guys, have you ever heard about the spinal cord injuries before? How it happened? Which medical equipment are used to diagnose and treating patients with a spinal cord injuries? Either X-ray machines, CT scan or MRI machine? The answer should be MRI machine. Why? Don't worry. In this video, I will explain about the MRI features in diagnosing and treating patients with a spinal cord injuries. So, don't waste our time and let's get started. The spinal cord is a tubular bundle of nerve tissue and absolutely vital part of our nervous system that located in a vertebral canal and reaches from the base of the skull to the upper part of lower back. The spinal cord is surrounded by the bones of the spine and a sac containing cerebrospinal fluids. It carries an electrical information to and from our brains and allow us to move, keep us breathing, and ultimately keep us alive. Magnetic resonance imaging, that also known as MRI, is a non-invasive imaging technology uses a large magnet, radio wave, and computer that produce three-dimensional detailed anatomy images. Besides, it is often used for disease detection, diagnosis, and treatment monitoring. The MRI scanners are particularly suited to image the non-bone parts of soft tissue of the body. The spinal cord injury are seen much more clearly with MRI than regular X-ray and CT scan. The scanner itself typically resembles a large tube with table in the middle that allowing the patient to slide in. To diagnose the spinal cord injuries, the technologists will perform the MRI of injured spinal cord both in axial and sagittal planes using a combination of pulse sequences. The diagnosis was performed with patient in supine position with quiet breathing and with abdominal band compression, obtaining the T2 and T1 weighted fast spin echo images, short tau inversion recovery or known as stir and fat suppression images, coronal stir and axial T2, T1 weighted fast spin echo images, and record echo or GRE images for proper evaluation of cord. Besides, MRI plays a crucial role in the diagnostic workup as it reveals extrinsic compression of the spinal cord and disruption of this colligamentous complex. Additionally, it can reveal microstructural evidence of primary intramedullary damage such as hemorrhage, edema, post-traumatic cystic cavities, and tissue bridges. For example, using MRI patients who have a cervical spinal cord injury before they undergo traction treatment allows the doctor to see a possible disc bulge or herniation. Identifying a disc disorder before traction may help to prevent new or additional nerve-related problems down the line. During the examination, the MRI will produce produce the radio wave manipulate the magnetic position of the atom of the body, which are picked up by the powerful antenna and sent to a computer. The computer will perform a million of calculations used to create a cross-sectional black and white images of the body. These images can be reconstructed into three-dimensional or 3D pictures of the scan area. This helps to pinpoint problems at the spinal cord when the scan focuses on that area. The advantages of MRI, such as higher contrast resolutions, absence of bone artifacts, multiplanar capability, and a variety of pulse sequences, make possible to diagnose the spinal cord trauma more accurately. The disadvantages of MRI scanner in diagnosing the spinal cord injury are prolonged spinal immobilization may limit the patient care, leading to difficulty with mobilization, pulmonary dysfunction due to aspiration or pneumonia, and increase the incidence of pressure ulceration. Transport to MRI is frequently lengthy, and patient monitoring during the actual MRI is often inadequate. I think that's all from me. Thank you for watching and bye-bye.